Hello, MPH class of 2015. I'm actually a recent graduate of the MPH class of 2014, and I thought I'd create this little slideshow to help anyone who's coming to Johns Hopkins School of Public Health. And I did this because when I came, I was sort of confused about what's what, and I thought I'd just give just the student side, student's perspective of how this, what we're supposed to be doing, what not doing. You're going to get tons and tons of information in the coming months, so this is just me trying to give some information. Um, Begin. Welcome, of course, to the number one school of public health. You will be hearing this over and over and over again. And there, it's true. This is the number one school of public health, and as you will see throughout the year, you'll see why it is the number one school of public health. I actually enjoyed my time here. It was at times difficult because of all the coursework that I put on myself, but at the same time, it was enjoyable. Everyone was approachable, friendly. Teachers were excellent, and I'm sure you'll enjoy your time here as well. So the first thing I'd begin is I'll just introduce Dean KLAG to you. He is the Dean of the School of Public Health. He is actually one of the nicest deans you will ever meet. He's extremely approachable. He responds to students' emails. I actually sent him an email at the very beginning of the year. For whatever reason, it got into his junk email folder, and he actually responded a couple months later saying, "Oh, I saw your email in the junk folder, and I thought I'd respond back." Excellent human person. Really, I can't speak enough. Excellent dean. Very, very nice. If you can make it, see if you can. A group of you could possibly meet him as in one group. His time is limited though, so he is the dean and he's got to go everywhere and everywhere. He's got to do a lot of things. But if you can, introduce yourself, shake his hands. He's an excellent person. The next person you'll likely meet is Dr. DIENER West. She's the chair of the MPH program, and you will likely be getting lots of emails from her. She is, I will say, one of the best professors you will ever meet, period. She is extremely nice. She's always open to anyone's request, no matter how zany or crazy. She will direct you to the proper person to speak to. She responds to emails in an amazing time. Extremely efficient. If you can, she teaches actually the biostats 620 series. You'll see that you'll figure out what that is later on, or I can tell you later on. Extremely nice person, almost motherly figure in the entire school. Excellent, excellent professor. I cannot say enough good things about Dr. Dina Marie West. Coincidentally, there's actually an old picture of her. Well, when she first graduated, her undergraduate. I was thinking of putting that in, but if I put that in, I think she would have killed me. But anyway, we'll go on. So when you come to the MPH program, you're going to be inundated with all these things of concentration, capstone, practicum, certificates. What the heck is all this stuff? So when I came, I didn't know what, I sort of had a vague idea what a concentration is, not is. So everyone can actually, there are certain concentrations. So these are things that you can sort of concentrate your studies at. So if you're interested in, so I concentrated in epidemiology and biostats. And if you do that concentration, there is certain set course work that needs to be completed to complete that concentration. But I will tell you, nowhere on your diploma, or sorry, degree or what have you, does it ever say you were concentrated in this study. All it says is this degree has been awarded to so and so, the Masters of Public Health. It never says that this person concentrated in epidemiology and biostats or child and adolescent health or anything like that. I completed the epidemiology biostats concentration. Nowhere does it say, that this person concentrated. So you could do anything you feel like. So that's why the first one you'll see is customized program or study. That's what it is. You can do anything you feel like in the MPH program. You're going to hear this term, oh, you're like a kid in a candy shop. And you sort of are actually, because there's so many courses you want to take. You know what to take. can go crazy. But anyway, you can pick one of these concentrations, but you're not exactly restricted to this. Meaning you could actually do, say, the biostats epi concentration and do that halfway, and then leave that concentration and do whatever else you feel like, and it becomes a customized program. The only issue is if you go to a customized program and then you want to say do biostats and epi as a concentration, that can get very tricky because you don't have the necessary coursework. Um, it's difficult, but honestly, you don't have to concentrate in anything. But I did. Um, so the next thing I guess I'll talk about is certificates. Now you're going to hear this thing about certificates. What is this certificate thing? So basically, I think a certificate to me was, and I did actually two, which is almost suicide. But anyway, um, the certificates are essentially add-ons to the MPH. They're not required to graduate. You don't have to do any certificates to graduate the MPH program. It's just basically, like, I thought of it as an additional skill set to add on, sort of like a minor, but you don't have to do any certificates. You don't have to you can start a little bit of it and stop if you want, what have you. It's something that I guess you could put on your resume and say, I have a certificate in such and such, and you are awarded a separate piece of paper saying this person has been awarded a certificate. So I did it in risk policy and informatics, but it got almost too much to handle essentially. There will be multiple information sessions that you will have about each certificate, and there will be a fair. But I can speak more about certificates later on. But again, this is just I thought I'd just introduce the idea. So the other thing is the capstone. You're going to hear this. Now, this is required. This is basically how I define it is more of a research paper. This is not a dissertation. This is not a thesis defense. This is basically, imagine a short scientific journal publication. You'd put something with an abstract, introduction, methods, results, discussion, and conclusion, what have you. This is not a, like I said, this is just basically a paper, but it is required. You need to complete a capstone in order to graduate in MPH. My biggest thing is you need to start early and find various professors that want to do a capstone with you. I will address this later on. I actually had some issues getting a capstone started early. I was it got a little bit hairy, but but at the same time, it was not that bad. Anyway, next, practicum. Now, this is also something that you will have to do. Now, for our class, this was a necessary measure. This is 100 hours. Basically, you have to complete 100 hours of practical experience. And you basically are applying the skills and knowledge that you gained in your MPH. So I actually did like basically 3 practicums, if you can believe that. So you didn't know, no one had to do that. I was a little bit I was a little bit crazy, but anyway, you could actually do most of your practicum actually could be completed with one course at the 4th term, called public health policy. But I did also a practicum in my certificate in informatics, and I also did a practicum in a source. I'll mention that later. What is source? But I did not count those. I just counted the 100 hours that I needed from the 4th term. But I can speak later on about that too. The other thing are clubs. So you're going to be inundated with a whole bunch of clubs. Like there's going to be more clubs than you can shake a stick at. And each one is, basically allows you to explore your interests further. So there's student council. I was actually part of SOURCE. And there's also the Anna Baker Society. All these various societies will come to you and describe who and what they are, but of course they are not necessary. They're just there to enrich your experience at Johns Hopkins School of Public Health. I can speak more of this. So what I will be doing, this is the end basically. So I can continue. I will have other talks or other whatever emails. YouTubes about each individual issue in more in depth, but this was sort of general breather. You guys can ask me any questions you want. I have always free to answer any question. Yeah, well, I'll see you later. Thanks. Bye.